is okay, 2. What are we doing with the 2? So like Shirley. Yeah, okay, so like cranial nerve number 2, what are we saying for the optic nerve? First of all, I'm going to be asking, do you wear any glasses? No, the contact lenses. Did you have LASIK surgery? Okay, so but you have contact lenses on. Okay, so it's corrected then. So what I'm going to do, I'm going to be asking this patient I'm going to be checking the vision. So, all right. So this the vision. It's going to be 14 inches away, and so why don't you cover one eye? Okay, so this is a barrier. Cover one eye, and then hold this. Okay, sorry. Hold this. Okay, so hold it. Okay, drop it. And you hold it. I'm not going to hold it. You're going to hold it. Okay. All right. So now, can you read the lowest line?
426739.
Okay. Then change it. Okay.
That again?
Yeah.
426739.
What did I do wrong? I should have done like both eyes first, right? So first of all, I have to assess like, is she seeing? All right, so read with both eyes first. All right.
426739.
Okay, now you'll do like one eye at a time.
426739.
Okay, the other one.
426739.
Okay, all right, so the eyes are 20/20 OU, OD, and OS. OU is both, OD is the right, OS is the left. All right, so now what I'm going to do, so this is cranial nerve number 2, so it's cranial nerve number 3. What I'm going to do, I'm going to be checking the constriction of the pupil. So I'm going to be putting this on the bridge of the nose. Okay, cover. Okay, let's see. All right, so it's okay. Then I put it again, and this time I'm going to check this side. All right, so then I'm going to be checking this. Okay, it's constricted. Okay, I put it here again, but this time I'm going to check here. Okay, so the pupil constricted to direct and indirect or consensual light, right? So, and then, so the cranial nerve number 3 is intact. Is that clear? All right, so this is cranial nerve number 3. The other cranial number 3 is for, hold it because we're going to do cover on cover, right? Okay, so, and then, so like I'm going to ask you to watch here, and then as I'm coming forward, focus. So this is like, you don't go all the way here, like you don't, because the students are doing it. In the test, it says 6 inches, right? So like you come here all the way. All right, so, okay, so now like it's converging. It's converging. I can see the pupils are converging. But to make sure, what do? I have to do cover on cover. Okay, cover one eye, and then, so when you're doing cover on cover, you don't have to move, because moving, what are you checking? The other eye is covered. You don't see anything. So you might as well do the focus. All right, just focus. All right, very good. And the other one, okay, it's focusing also. So, okay, put the other eye. Okay, so look like I'm holding. Okay, focus. Okay, the other one is focusing also. Cranial number 3 is intact. I verified it with cover and cover. Is that clear? So there is no movement when you're doing cover on cover. It's only focus. Do you see why? Because if you move, are you seeing the cover eye? You don't see the cover eye. Like, what are you doing? You're doing. Don't only focus. All right. So the other test is we're going to do the EOMs. EOMs are going to be testing cranial number 3, 4, and 6. Okay. So 3 is oculomotor, 4 is trochlear, and then 6 is acusate. Okay. Up, down, up, down, up, down. There is no lid line. All right, so the EOMs are intact. So everything was the 3, 4, and 6, and then up and down was only 3. All right, so we checked whether there is lid line also or not. So the eyelids were covered; they didn't lag. All right, so we're done with the eyes, right? So now, what are we gonna do next? We're gonna be doing the, let's see, the lymph. Oh, that's the lymph nodes. Okay, so what is it like? We're done with the 1, 2, 3, 4, and 6. So let's do the 5. Yeah.
Oh no, I'm saying 5.
5. So let's do the 5. 5 is the trigeminal. All right. So oh yeah, we forgot the confrontation. confrontation, very good. So the confrontation, because like we did the central vision with the chart, we forgot the peripheral vision. So that's cranial number 2 also. So what do we do? Okay, so cover. Alright, very good. So alright, so we cover this. If you cover this. Okay, so can you see? Can you see?
Yes.
Can you see?
Yes.
Alright, so can you see?
Yes.
Can you see?
Yes.
Can you see?
Yes.
Okay, so this is peripheral vision tested with confrontation. This is cranial nerve number 2, which is the optic nerve also. So there is central and this is the peripheral. Okay, very good. So we're done with the vision. Did we miss anything? So okay, so let's do cranial number 5. Cranial number 5 is for so now let's come here. Like we need the Q-tip. Right. So with the Q-tip, what do we need? So in the cranial number 5, the sensory, it senses the sharp and the dull, and then any sensation on the face, right? Okay. So I'm gonna be breaking this. All right. So I created the sharp. So this is okay. So this is sharp. It's very sharp. And this is dull. Okay. So what we're gonna do? I'm gonna ask her to close her eyes because otherwise she sees the sharp and she's gonna say sharp, right? Okay. What is this? Oh. What is this?
Sharp.
Okay. What is this?
Sharp.
What is this?
Sharp.
What is this?
Dull. Sharp.
Okay. So you're gonna confuse her, right? So it's otherwise like she will know it. After sharp there is dull, after dull there is sharp, right? Okay. So alright, so this is cranial number 5, the sensory. So then we're going to be doing the cranial nerve 5 motor. So what is it like? Okay, open your mouth, close your mouth, move your mouth right and left. Okay, so I can see the temporal mandibular joint to be smooth because I cannot feel any crackles, and she opened and closed her mouth and moved her jaw smoothly. Alright, so there is another test here when you're gonna, I'm not gonna do it, so like you're gonna say that, okay, if I put I'm not gonna do it. So if I'm gonna touch the cornea, and then who feels it? Trigeminal sensory, right? And then as a result, what's gonna happen? 7, facial is gonna constrict the pupil, not close the eyelid, or blink the eye, right? Okay. So we're not doing it because it's a little bit invasive. We don't want to hurt anybody, but like you have to know though, right? Okay, so we're done with the 5. All right, now we're coming to 7. 7 is the facial. All right, so the facial sensory is like when we stick your tongue out, but we're not putting anything. So if I'm gonna put like salt here, how does she feel with cranial nerve number 9? If I put salt in the middle, how does she feel the salt? Cranial nerve number 7, sensory, right? Okay, but we're not doing it because it's a little bit invasive too. All right, so now, that's the facial sensory. We're not doing it, but you have to know though if I ask, right? Okay, so now there is the 7 motor. So it's the facial expression: smile, frown, puff your cheeks. Okay, close your eyes tight. Okay. Do you see? Okay, I cannot open. All right, so purse lip, kiss, okay. I cannot open. So this is cranial number 7. You see, all these expressions, the movement, 7. All right, so when I put the cotton in the cornea, how did she close? Blinks, okay, blinks. So who did it? 7 motor, okay. So 8 is the acoustic. All right, so first, like I'm gonna be doing the whispers. Yeah.
So in patients who have stroke, when you try to do this,
Yeah.
it'll open?
They will open, they don't have a strength. So it means that the facial nerve has been affected. It depends what lobe the stroke is.
Okay.
All right, so accordingly, that nerve is gonna be influenced.
So which lobe will be affected?
Yeah.
To affect that?
Because where is, Aghavni, you were asking, were you asking like where are they origin? I think Elliot was asking where are they originated with which lobe. So I'm not going to be asking that. So just like cranial nerves originate from the brain. That's all you have to know. But if the stroke is here, and then if there is a nerve that is originating from, that's going to be affected. Does that make sense? So because a stroke is not going to affect the whole brain, part of them. Hopefully not, because otherwise it's going to be very detrimental, right? All right. So now the 8. How do we start with the whisper test? Okay. So I'm going to ask actually cover this ear. So I'm behind here. Okay. I'm going to tell you something. You have to repeat, right? Okay.
Green chair.
Okay. Great. Change it. All right. So I am going to be at at the place that she's open, right? Okay. All right. So and then the other one is going to be covered. Why we cover? Because this can be deaf, but she can hear from the other, right? So then, okay, what did you prove? Nothing, right? So it has to be 2 syllabi.
Pink bag.
Okay. All right. So this is the whisper test. Like we passed. All right. So now then we're going to be doing the Weber. The Weber. What do I need for the Weber? I need tuning fork. Okay. So all your equipment is going to be on the table. So, all right. So don't hit your hand because every time when I'm seeing patients, I used to hit, and then I go at home, like, it hurts so bad afterwards. Okay, so this is a good area to hit because it's soft, like you're not gonna make a big noise either. All right, because it's gonna be unpleasant to make a. It didn't vibrate. All right. So, before I do this, I have to explain to her, right? Okay. So I'm going to be placing this on your forehead, and you're going to tell me like what you hear, because this is a hearing test, obviously, and how much you hear, right? Okay. Okay. So, okay. Now I think there is a vibration.
Oh, yeah, I hear it.
Okay. So where is it? All over.
Yeah, it's everywhere.
Okay, that's good. That's what we want. We want it all over. So this is the Weber test, and then it proved the bone conduction. So the vibration is kind of done with the bone conduction. All right. Now we're going to be doing another test. It's easy. This one also. It's going to compare the air conduction to the bone conduction. So I'm going to be putting this on your mastoid bone here, and then you're going to be hearing the vibration. When you stop, like, you have to raise your hand, all right? And then I'll put it in front of your ear, and then when you stop, you hear. When you stop, you raise your hand, and I'm going to compare. All right? So, okay, I don't have to tell her I want to compare. She doesn't need to know, right? Okay, but at least you have to say when she's going to raise the hand. So this is when you need your timer, or you need like a traditional. I think this one yeah, this one has also the third one, right? Okay, you have to count. All right, so you have to have like a watch or timer that has like the third leg or arm. Okay. Okay, then this needs practice too, apparently. Heating needs practice too. This is dying. Okay, good. 10 seconds versus 20 seconds. All right, so the air conduction 120 seconds, and then the bone conduction 110 seconds. So it was 2 to 1. Always remember that like it doesn't have to be exactly double. As long as if it's more, it's good. Is that clear? And then this is dying like in the middle. Is there a way like it will be lit? Because it went black, huh?
Mine does the same thing. When I'm like trying to count our respirations, it just dies.
Yeah.
Yeah.
This will die. Like
It just the screen goes black. So the battery isn't dying. It's just the
also
it dims.
it dims. Like what is the what do you what
you
the
can change
person?
it. Certain if you have a newer one, it lasts longer, maybe like a minute or
Okay.
so.
All right. So if it's dying, so it's not going to be a good tool. You have to get your traditional. Check your batteries of your watches. I know by now everything is dead, maybe like in the cabinet. Right? Okay, I'm coming here. So. Okay, 16 and 20. All right, so 16 was the light conduction, and then 20 was the air conduction.
Oh, okay.
Okay, seconds, all right. So still the 20 is more than 16, so that's correct. Is that clear? All right, so this was the Riney test, and so it kind of checked the hearing, and it compared air conduction versus the bone conduction. So we're done with the 8. Now we're coming with the 9, right? So 9, what is 9? 9 is glossopharyngeal, and then 10 is the vagus. All right, so now for this, what do we need? We need, like, the 9 is, you have to check the sensory for the taste. And I'm gonna say, okay, Shirley, take your tongue out, and I'm gonna put, okay, I can't even put salt at the back of the tongue. It's not,
So you
it's
want
not
us to pretend?
No, don't pretend. You don't even have to say it.
Okay.
All right, so if I ask you, say, no, you don't pretend.
Okay.
Okay, because we're not doing it, because I'm just doing it for you so that you know. So it's very unpractical to put, like, any food at the back of the tongue, and then we're not going to be doing it because it's intrusive. And then just for the sake of learning, so cranial number 9, glossopharyngeal, identifies taste at the back of the tongue, the posterior side of the tongue.
So we can just say what the cranial nerve does, we don't really have
Yeah,
to test it.
Yeah, you can say that, and you don't have to pretend or anything. Correct. So 9, this is the sensory. So now 9 has more work as far as motor, right? So what I'm gonna do now, like, I can put gloves on, and so I'm gonna be checking the okay. So now my equipment here, what is it?
Yeah, we don't want to gag.
No, yeah, I'm not gonna get. I mean, I'm just pretending.
Okay, good. Very
So I'm
good.
not gonna.
Thank you.
Okay.
She
Okay. So now, like, to check the cranial nerve number 9 and 10, I can do it together. So I have to use the tongue depressor. So the tongue depressor, when I put it, always, like, what do you need to have when you're doing the mouth?
Gloves.
I know, what else? Light, always light. So don't forget, you know, so obviously I'm not very organized, I'm coming here and there because everything has to be on the thing. Okay, alright, so now, if I'm gonna be putting at the back of the tongue, so the touch is gonna be felt by cranial nerve number 10 sensory. The taste is going to be detected by cranial nerve number 9 sensory. Is that clear? Okay, so open your mouth. Okay. Okay. All right. I can see the uvula is midline. Midline means that its cranial nerve number 12 is intact. Rises with phonation, it's going up. It means that cranial nerve number 9 motor is intact. And so, like, you know, I touched her, and then the touch is, the touch of the tongue depressor is felt by cranial number 10 sensory. The taste was detected by cranial nerve number 9 sensory. As a result, she gagged, and gag is cranial number 9 and 10. Is that clear?
Mm-hmm.
Okay.
Just to be clear, we're doing the tongue depressor.
Yeah, you're doing the tongue depressor. You're doing the tongue depressor, okay? So, and then you have to have the glove and then also the light, because otherwise, how are you going to do it? All right, so that's that. And then, okay, and then open your mouth again. So I can see the uvula is midline, and so that means that cranial number 12 is intact. Stick your tongue out. Okay, so push. Good. Push. Push. All right. So cranial number 12 is intact because it assesses the strength of the tongue. All right. So. And then, so there is not, I'm not going to test it swallowing now. Okay, so that's it. The only thing left here, okay, I can take this off. The gauze, we were going to do it when we're going to do it with the mouth. That's inspection of the mouth. It's nothing to do with cranial nerve. But you do it together because it only makes sense. Does that make sense? Well, what did she say? She said, you know, why didn't you get the gauze and then inspect? The gauze is, you take the gauze 2 by 2, and then I hold the tongue, and I'm looking. What am I doing? I'm inspecting. Is that clear? So that's inspection. we're not checking the tongue strength then.
Okay.
Okay, but you have to do it at the same time because like you don't take gloves off and then glove in, you know, like because you marry it together.
Okay.
Okay, so good point. Did you see what she asked? Does it make sense to you guys? Yeah, you do the gauze when I'm doing this because you have gloves already and you're touching the tongue anyway. All right, but like that's nothing to do with the cranial nerves. It's inspection. What are you looking? Fissures, a skin irritation. You know, like is there any growth? Usually, like with the elderly, you're gonna be having problems. Right? Yeah. Okay. Very good. Good point. All right. So now the other thing is left is the 11. So now, like this is my trash. Where am I putting it? I have my little trash can, so I put it here. Do you see? All right, so now the only thing left is cranial number 11. Okay, shrug your shoulder. All right, so like I'm at the same time I'm doing this, I'm checking the trapezius muscle. Trapezius muscle is circus plus 5, nothing to do with the neuro. It was like it's a good place to check it. All right, so that's it. We're done with the cranial nerves. Go ahead and start practicing, and then I'm gonna show you later on the reflexes.